name is Dr. David Ginsberg, and I am a practicing chiropractor in Geneva, Illinois. Today we are talking about the Webster In-Utero constraint technique, and I've been practicing chiropractic for 19 years with a specialty in pregnancy and pediatrics. And the Webster technique differs from an external version where the baby is actually physically you're trying to turn the baby. With the Webster technique, the purpose is to create a better internal environment, and that is done through the use of a specific chiropractic adjustments and analysis, as well as some trigger point techniques. The technique was developed by Dr. Larry Webster, and he reports over a 97% success rate. And in the past 19 years, I've seen about 80 to 85% success rate with really no complications at all. So, what myself and many other practitioners that do the kind of work that I do have found is that with the abnormal fetal presentation, most of the time the women have pelvic subluxations that have created tension on the utosacral ligaments, distorted the shape of the uterus as well as the pelvic opening, and prevent the normal version or turning of the fetus. So with our evaluation, we're going to start out by taking a normal maternal history, and then in many instances we will perform an abdominal exam to determine what the fetal presentation is, although in most instances this has already been done by the obstetrician. This would be followed by a typical chiropractic evaluation, which includes range of motion and any orthopedic tests to determine if there are any pelvic misalignments or subluxations or lumbosacral joint stress, and then we would finish off with a spinal exam. In addition to helping sciatica and alleviate low back pain, chiropractic care throughout the pregnancy can help to prevent the abnormal fetal position or the breech lie, as well as making for a quicker and smoother labor. Okay, so at this point we're going to demonstrate the beginning of the evaluation for the Webster In-Utero constraint. And this part will start out with a typical chiropractic evaluation, spinal evaluation. This is Jennifer. She is 8 months pregnant. Now we already know that she has a normal fetal lie, or the fetus is head down, but we're going to go through the evaluation anyway. So we'll start out with a spinal exam. Jennifer, how's your back been? Have you had any discomfort at all?
Not really. I've been really good so far.
Good. Very good. So we start with some static palpation. Typically we're looking for swelling or any tenderness, and there's a little swelling at the bottom here. Is that a little tender where my finger is?
A little bit.
Yeah. So right at the lumbosacral joint. And how about on the right or the left?
Oh, the left. Definitely the left.
Okay, so there's some tenderness in the left SI. Next we're going to do is we're going to go ahead and run our instrumentation. This basically measures heat and gives us another idea if there is pressure down there on some of the nerves, and it's an indication if there's any misalignments down there. Okay, I've got a reading close by. And then the next thing we're going to be doing is palpating the area for any muscle tightness or spasm. How are you feeling in here?
A little tight, a little sore there.
Both sides?
Yep.
Okay. And she is a little bunched up on the sides here. It's difficult to see on the video, but you can feel it. And bend forward for me. Okay, come on back up. And you may be able to see my right finger. Bend forward again. Rising up higher than the left. Come on back. And that's because this right side is restricted. So at this point it's looking like the right SI joint and possibly her fifth lumbar. We'll check the motion of that. Go ahead and arch your back for me. Relax it. Okay. And that's not tucking. So the lumbosacral joint and the right SI joint are restricted. So now we're going to come over here. Step one of the in-utero constraint technique is a leg check. So the patient is face down. We've got our legs propped for comfort for the abdomen. And I'm just going to grab the ankles, relax your legs, Jennifer, and I'm going to just bend these up here. And I'm feeling the resistance. And relax it. And basically, on the side, where there's more resistance. So her right leg is feeling a little bit more resistance here. It's not going all the way. You can come on up. The theory is that the sacrum, or her pelvis, is misaligned on that side. And I would confirm that with my exam findings, which I did, showed a right SI fixation. That's going to torque the pelvis and the uterus and make it less favorable environment for you or for your little baby. So come on over here. We're going to lay you on your side towards me. Very good. And now what we're going to do is we're going to make an adjustment to realign the sacrum on that side. Good. Nice and relaxed there. And I'm going to contact in that SI joint. Really loose right there. Good. Excellent. Okay. Come on up. Now what we're going to do is we're going to recheck those legs. I might have you lay face down again. And ideally what we want to see is that the restriction goes away. I know I got a good adjustment, but if the restriction doesn't go away, then we would typically adjust again. So relax those legs. Good. And that's feeling nice and equal. Okay. Come on. Okay. In step 3 of the in-utero constraint technique, we're going to be trying to locate a trigger point over the rectus abdominis muscle and down over the broad ligament. And the way we're going to do that is we're going to go to the side opposite that we just adjusted. So we adjusted her right side sacrum, and we're going to go ahead, I'm going to pull this up a little bit here, and then we're going to take this down. So we're going to locate the umbilicus, and what we're going to do with the superior hand, we're going to take a knife edge 45-degree down and out, inferior lateral, and then from her ASIS, we're going to do another 45-degree knife edge. And where those 2 points intersect, we're going to take some thumb pressure, and we're going to just apply gradually down, and then a little bit towards her head. And oftentimes the patient will feel tenderness over that trigger point there. So you got a little bit of a trigger point there. Yeah. We're going to contact that. And the trigger point is held for a minimum of 1 to 2 minutes. It has been held up to 35 minutes, although that is not normal. Oftentimes you will start to feel the baby move in this position here. Sometimes you'll actually feel it flip around. And again, that happens sometimes on the first visit and sometimes on other visits. Are you feeling any activity?
A little bit, yeah.
A little bit of activity. Now, occasionally, if we don't feel much movement, what we can do is take our other hand and place it on the other side of the abdomen and just apply a slight counter pressure here to hold. And again, that's comfortable.
Yes.
Yeah. It's very rare that the patient's uncomfortable. The trigger point can be a little bit sore. And then once we do this, then the patient's told to just go home and do their normal activities, and we typically have them come back the next day. So, in summary, the Webster technique is extremely effective. Typical resolution or turning of the fetus occurs in 3 to 10 sessions, although it can occur in the first session. It's very comfortable for the mother. It is extremely safe. And as I said earlier, it's very, very effective, up to 97% success rate.